the next order of business is just the opioid fund discussion. I tried to put that up there because Alicia will be joining us from community development. And I also have Bridget Stark here and Nadia. Nadia, do you want to state your last name?
Yeah, it's Schessler.
Okay. All right. So Alicia, if you want to introduce yourself and take it from there.
Can I ask can I just mention why I asked Alicia to come?
Yeah.
Okay, because you guys, I had for Dr. Osborne and Letitia, I'm not sure, I think my email was reworded, but I had asked to have an email forwarded to you guys. The Board of Health was mentioned on recently on something online about the opioid settlement abatement funds that were given to us by the state. So a lot of people, two incredible community members who are on right now and more that are joining, had reached out to me because I work in the harm reduction field and asked kind of what our involvement was, what we were doing. The more I looked into it, I was shocked. I didn't even realize that we've had the funds since 2022, and we are well over $500,000 that we were excitingly given, well, not given, but awarded by the settlement funds. So I also emailed you guys the state guidelines and all the funds that we have. It's exciting, it's positive. But also kind of, I was alarmed, working in harm reduction. And as we, as the Board of Health, and Tim and his team and Debbie get daily, and there's not enough of them to get all, with the hard work they do, concerns about needle exchange, needles, and those suffering with substance use disorder. And I thought, oh, mind blown. We're sitting on $500,000+ that could help these beautiful humans. And us as the Board of Health, being health professionals, I think should be such a huge part of that. So I asked Alicia Zoeller, who's the Director of Community Benefits, to come kind of just update us, explain to us what the plans are. Just question, why have we had those funds since 2022 and we haven't used them yet? And I'll stop talking because I could ramble for days about the beautiful humans suffering with substance or opioid use disorder in our community. But why I'm so passionate and why I asked just for some answers and clarification and updates. We have lost a reported of 64 community members in Holyoke, that's a Holyoke number, to opioid deaths since we received the first settlement fund, which was $72,000 in July of 2022. Since then, we've quadrupled that number in funds that we have. And I think that's 64 deaths too many when we have the funds to help and combat this. And that is not related to the 80 correlated opioid use deaths that our Holyoke citizens have had. So it is, like I said, it is 64 deaths too many for a city that is sitting on $500,000+ to combat this opioid epidemic. And I just would love to know what we're doing and how we can help, and how the beautiful professionals that are working hard in our community can be part of it. Because as I sent out, the Attorney General has guidelines, and people with lived experience, people with family members who've died of opioid use disorder, and those who work in it are all required to be part of this awesome and exciting process that we have. So that's my ramble. So my question, just an update, kind of what do we got going on? How do you need our help? And why haven't we used those funds and gotten this off the ground, seeing as we've had the funds since 2022?
Nicole, did you want to reach out to community members first, or would you like me to start?
So that was something, so we weren't part of this, so that wasn't my opportunity to reach out to community. Do you mean for the community?
Just right now, because you have some community members here.
Oh, no, they're here to listen. They have the same questions I do. Oh, yeah. No, they're here to hear your updates and just, let us know why we haven't used them and what we got going on and how fast we're going to get these out to our community members.
And if anybody has any questions too, they can raise their hand, or maybe we should have something at the end. That way we're not leaving anybody out. And I see we have Earl Miller and someone.
Our community members that are here are just beautiful, great people who are working hard on the ground, and they know better than the rest of us how we need to use these funds. And I want their voices heard if they want to be heard.
So if we could hold questions till the end, because I think I'm going to cover most areas. I have a good idea where folks' questions are. So if we want to hold them to the end, I can get through I don't have a formal presentation, but sort of get through the overview, and then happy to take questions and stay on as long as needed to get everybody the answers that they're looking for. So first of all, the city did start to receive payments back in July 2022. However, the system, when funds come to the city, there's a system that has to be set up internally around financial management on how the funds are deposited in an account, who is responsible for those funds. It's not simply the city gets a check and then they can disperse it. So the process to get this money in-house and then set up the accounting, there was a lag. I'll acknowledge there was a lag. Part of the lag, my understanding, is that the guidance wasn't available initially from DLS, from state DLS, on how to do it, where to fund it. The fund that holds these funds was set up in August of 2024. That was when the auditor's office actually set up the account. The responsibility for these payments lagged as well. The initial funding came in and it landed in the procurement department for whatever reason. It then bounced over to the law department. I think there was a transition going on in the Board of Health. And so the responsibilities for these funds sort of migrated around City Hall until there was better guidance provided by the Attorney General's office and by DLS. The funds have now, as of last fall, landed in my office because by the way, I'm Alicia Zoeller. I'm the administrator of the Office for Community Development. The Office for Community Development is responsible for the administration of federal grants that come to the city. So we have traditionally managed community development block grant, home investment partnership program funds, and we have in the last 3 years taken responsibility for the $38 million of American Rescue Plan Act COVID recovery funds that have come in. We are a staff of 3. It's myself, my colleague Zaida is our finance manager, and my colleague Ashley is our special programs manager. In the same way that the Board of Health is understaffed and lacks capacity to expand into other areas, we've been facing the same thing. However, because the American Rescue Plan Act program is starting to move towards completion, we're hoping to have most of those projects wrapped up in the next year or so. When the mayor asked about opioid management, I felt like our office was probably best situated to do the financial management piece of it. And as part of that financial management piece, the Attorney General's office and the new CARE Massachusetts division, I think they're a division of the Attorney General's office, have laid out a process by which the funds can get distributed in the community. That process mirrors how we already allocate community development block grant funds, in that there needs to be a needs assessment, there needs to be detailed community input, there needs to be public forums, public meetings, speaking. So on the CDBG side, we go out and we work with households that live in low and moderate income neighborhoods in our community. In this case, we would be going out and working with people who have been impacted by substance use disorder, family members, active users, those in recovery, general community members. The population that these funds are intended to benefit is different than the CDBG and the HUD world, but the processes are very similar. In management of these funds, it's not simply that you can write a check, somebody comes in and says, I'd like to access the money, and the city writes a check. There does have to be a procurement process. It has to be fair, open, and transparent. And again, mirroring that CDBG process seemed to be the best way to meet all of the requirements of the AG's office and the settlement agreements. That being said, we first had to develop a management plan and a management plan really covers the who, what, when, where, why, how of how the money is going to flow, what the process is for allocation, what department is responsible for what piece of this. That management plan I drafted. It has now been reviewed by the mayor and by Tim Rivers. They have both agreed. The mayor has approved it. And so using that management plan, we are now at a point where we can move forward with the actual process to begin community assessments, begin looking at our needs in the community, working with our community partners to do some survey work, outreach, community forums, that sort of thing. We then need to develop a needs assessment document that says, here's what we have identified as the needs in the city of Holyoke, including all of the voices and all of the folks that will come to the table to support that effort. That needs assessment is then put out as a public document for public comment. So people have an opportunity to see what were the survey results, what came out of this community assessment. That's reviewed. And then that document that identifies the needs is then rolled into an application process where entities will be able to come in and apply and request funding. And so that funding can be for any of the enumerated uses that the Attorney General has identified, but folks will be able to have the opportunity to apply, whether that's a nonprofit, a faith-based, a housing developer, a service provider, a medical clinic, that sort of thing. One of the reasons that we use the application process is that we want to be able to vet any organization that receives funds to make sure that they have the capacity, the financial experience, the ability to complete the program that they've applied for funds for. That certainly comes out of experiences that we've had in the CDBG world, as well as the ARPA world. We want to make sure that if an organization comes in and says they're going to provide counseling, that they have the experience to provide that counseling, that they have the track record, that they have the financial management ability for those funds, that they're even eligible to do business with the government, that they haven't been, we use the term debarred. So it's not as simple as having folks ask for money and distributing that money. The mayor has insisted, as we do with American Rescue Plan Act, CDBG, and the other federal programs that we administer, that the process is deliberative, it's transparent, it's open, and that it results in identifiable accomplishments in the community. All of that takes time. It takes staff capacity, but I feel like at this point we've really ramped up. So the management plan is done. We'll be posting that online. We do have a website where folks can fill out a form that comes to me that highlights their interest in their participation in this whole process, whether they're a community provider, a resident, someone who's currently using on the streets and is looking for services. So we do have that form up. We've gotten about 15, I'd say, inquiries so far that we're keeping track of. We have had a couple of conversations with providers. The Y reached out to see how they could be supportive. And so we're gearing that up. The management plan will be posted on the website in the next couple of weeks. Right now, we're trying to close out a large grant application to HUD. So we're a bit behind, but the management plan will be posted. And then Tim and I and our special programs manager met yesterday. We've revised the schedule. So a schedule for all of this will be issued hopefully in the next 2 weeks as well. And it will outline target dates for community survey work, for completion of the needs assessment, when the grant applications will be available, and when the first contracts for funding will be made. In terms of how much money the city currently has in its coffers, our finance manager balanced as of March, and the current March balance was $1.1 million. So that's currently what we have to work with in this first round of grants that will go out. Now, of that 1.1 million, a portion of that needs to be used to pay the staff folks that are going to be working on this program, because currently there is no municipal budget allocated, no municipal general funds allocated to support the program. So a portion of the current balance will be used to pay the administrative costs. So whether that's salaries, benefits, postage, cell phones, that sort of thing.
But just to clarify, this isn't a grant. This is funds that were received from opioid settlement funds. Yeah,
Settlement.
It's just a difference. It's a big difference.
So when the community partners receive their funds, they will be receiving it as a grant, as opposed to a loan. So yes, there's settlement funds as they've come to the city. And then as we move to the next step, it will become a grant to the community partners. So a portion of that will be used for administration and planning purposes. We're working on that budget now. And then sort of the last piece to report out on is The mayor has been very interested in hiring a community response manager who would be dedicated to providing resources, referrals, networking around issues of opioid use, as well as connecting folks to other services like fair housing, perhaps tenants' rights, housing navigation, because the city of Holyoke does not have a housing office, nor do we have a social worker on staff. And so we really need someone who is the point of contact, whether someone calls the Board of Health or Debbie is out and needs to provide additional medical or mental health services to someone. We want to have a full-time staff person who's working on behalf of the city to make those connections. We have plenty of providers in Holyoke. What we don't have in City Hall is someone who is able to respond and make links and referrals. We're not looking to recreate programming within City Hall. We're looking to better connect people to the services that are currently available.
When you say we have plenty of providers, can you clarify that?
Sure. So when I say we have plenty of providers, the city of Holyoke does not need to become a social work agency or provide clinicians in-house. We have folks that we can refer to. So whether that's any of our providers at our local health centers, our nonprofits who are doing this work, we do have connections in the community. We have resources that we can tap into of folks who are doing frontline servicing.
Oh, okay. I just wanted clarification. I don't agree with it, but just wanted clarification. That's a very bold statement for many of us who work in the community to outline that we have enough providers to give resources to those struggling. Just wanted to clarify what you.
I'm not saying that we have enough necessarily, but there are providers in the city who are doing work that we can make referrals to. So it's making that position would be
that you're correct there. That was just a clarification because we absolutely do not have enough providers to care for the beautiful humans in our city suffering. Just wanted to clarify.
So that's where we're at with it. I'm happy to take questions.
I have a question. I don't know
Yeah.
So thank you for providing all this information, Alicia. I really appreciate it. I am curious on the website that you can fill out to express your interest. It says specifically on there, and I'm looking at it right now, agencies and organizations. Please use the form below to connect, and then you have to name an agency or organization, it looks like. And I just want to name that that's not following the mandate, like the mandate of these funds, or that people with lived and living experience, residents that like shouldn't have to say some affiliation, need to be centered in the conversation. So I'm just curious if that language can be changed and like what efforts the city is making right now to gather those people.
So we have not started our community outreach process yet, or our community assessment. The goal of the form right now is to identify community partners who would be willing to assist with that assessment work. So there's only 3 of us in my office. Tim does not have the staffing. The Board of Health does not have the staffing capacity to actually go out on the streets and do community assessment. So we are trying to identify partners in the community who would be willing to help with survey work, willing to help with interviewing, that sort of thing. So the initial ask, which is that form that's up, is for folks who would be willing to partner with us around that work. Our intent is to reach out to partner organizations who would be willing to assist with community assessment work. So doing those interviews, doing those public meetings, speaking with their clients, getting folks to complete surveys, making community events available for some of that survey and assessment work. We are hoping to make some money available to organizations to do that. So if an organization wants to apply and thinks that, small gift cards to get people to complete surveys is the way to go, we're going to be rolling that process out as well. But right now, that form is just to gauge the interest of who would be willing to partner with us at an agency level to start the community assessment process.
Got it. I just wanted to clarify that because I think when you were before that it was reaching out to that anybody could fill it out. I do want to name that like that presents a barrier to people because not everybody who would want to be part of this conversation and deserves to be and is also entitled to be part of this conversation are
It's
going to
actually
be
required to be part of the conversation.
right. So that's what
So-
I'm saying is if you're not affiliated, it's also like not taking into account that there are people who are not accessing services through these means where the city website actually would be the place that they would get information or through the social media. So I just want to say that it's like a bit short-sighted to say that there's not the capacity. If you have the ability to pull a list or to create a spreadsheet of people and their contact information, why would you exclude anybody? Like, why do they have to be? I
Right. And that's,
understand the point, but I just think that like you're missing this
we
is
haven't
past the
we
why.
haven't started the community assessment piece yet. So
But
once
other
the
people are
community-
supposed to be able to be part of the conversation. So I just don't understand like why is there going to be another push from the city to open this up and to create a sign up for it? Like,
So we have not started the community assessment piece, which means we have not started the process of reaching out to develop the needs assessment. So right now, I'm just trying to identify through that form agencies that would be willing to assist with that process. Once we know what that process looks like, we'll have all sorts of opportunities for people to weigh in. In the past, with other programs, we've used paper surveys, online surveys. We recently, in the last year and a half, we partnered with the city of Springfield around homeless services and actually hosted a community breakfast and asked folks to come in and have breakfast with us, get some information on resources, and then answer some surveys, talk to us about their needs. There's multitude of ways that I'm hoping to engage with the community. But that form is not the community engagement form. That is just asking who in the community would be willing to help us reach the people that we need to reach.
I appreciate that. I think it should say that because it doesn't say that anywhere on the website. Like,
Clarify that.
it should be extremely transparent. It should be very clear what the intention in the process is because personally, when I open that up or I show it to other residents in other communities that have done this work, it looks exclusionary. It looks like you are only looking to talk to providers and that you are not centering the lives of people with lived experience who may not be in the field, again, who may not be accessing services. Like, that's the point of this, is to cast as wide of a net as possible and not assume that only certain stakeholders or certain players are going to get the right people in the room. I totally appreciate what you're saying. I just needed to say that.
Nope, I absolutely heard. If I could characterize it, we haven't even knitted our net yet. We're not even there yet. So,
Which is what, yeah, and we appreciate the heck out of you coming today. That's why I called this meeting, because we're not there yet, but we're 3 years past. So that's why we're here asking these great questions. Earl and Claire, who are community members, also have questions.
Yeah, Claire was first, Earl, and then Dr. Osborne all had questions was the order it went in. I was gonna try to say that. Claire, if you want to say your last name, Claire.
Oh, thank you. Yeah, it's Claire McGale. I'm a resident in Holyoke. I'm also a person with lived experience who previously worked in the peer support part of addiction recovery. So I just want to also point out that as much as possible, I think the ask, especially from what I know from the Bureau of Substance and Addiction Services, is for as many community members as possible to be involved on the ground floor, which would mean that individuals are also given access to this work, perhaps in the form of a committee before, as soon as possible. So I just wanted to acknowledge that, and maybe that could be a topic of consideration. And as far as I know, BSAS and other peer recovery support centers have been reaching out to the city of Holyoke to say that exactly that. And so I do know that the opportunity has been there. I also want to point out, speaking of peer recovery support centers, and other peer programs, of which Holyoke has at least 2, they are functioning as resource brokers, connecting people with other services in the area. And so my question, I think, is why create a position within the city government, especially with funding such an issue, when there are already entities in Holyoke who are doing exactly that could be backed by the city of Holyoke?
I think that's a great question. Right now, there's no point person in the city to take phone calls, to make referrals, even to those organizations, to those peer recovery organizations. And both the Board of Health and the Mayor's office and the Community Development Office and other city departments as well get a very high volume of phone calls looking for assistance. We have a high number of walk-ins on a pretty regular basis looking for assistance. And so having that point person consistently providing information, maybe doing some case management, ensuring that folks are tied into the Hampden County Continuum of Care that provides housing assistance for those who are chronically homeless as well, making sure that we have that point person in City Hall. Again, we're not looking to recreate services. We're looking to create having a point person in City Hall who can field all of these inquiries and provide the assistance. Because right now, those phone calls, they primarily come to Tim and I and to the mayor's office. And there's just not enough time in the day to give the proper servicing.
Would the city consider some solutions of, I know that there are peer recovery centers that are staffing hospitals, for instance, with a recovery coach. Would that be something that the city could consider, somebody who's already doing that job, but to do it, you know, in tandem, so that, again, we're not recreating the wheel?
So I think there may be opportunities for partnerships, but the position that the community response manager position is broader than just opioids. It's also around housing and other community issues. So one piece of it is opioid related, but then there's also other pieces that are related to activities that are not directly opioid related. So again, issues around housing, community concerns, neighborhood concerns, that sort of thing.
Oh,
I'm going to jump in real
apologize.
quick there, Alicia. Claire, you're amazing. I'm just going to interrupt, but then you're right back on. These fundings, they have to be used for opioid related things. I just wanted to clarify that. They have to be. So we keep saying that we're going to go to other things. You said again, Alicia, that we would go to other things with it. It has to be used for opioid related.
Right. So the way that that's managed is we have a number of staff folks who work in various funding streams, and their timesheets are time managed so that those funding streams are only billed or invoiced for the work that they did towards that program. So for instance, I work in 4 or 5 different funding sources. And so for instance, tonight, I would invoice my time, my staff time on this project to, we haven't started billing the opioid settlement fund yet, but I would be in the future, once we get all of this worked out, my time here would have to be billed to the opioid settlement funds because there are no municipal dollars allocated to it.
Interesting.
So we do it's like a time on task. And so if one of my staff folks works 3 hours today in the community development block grant program, then that's the program that gets charged for their staff time. So that's how we do it. It's managed through a time allocation timesheet. Because we want to make sure that if this position, once this person gets hired and starts the work, we want to make sure that if they're working in the opioid program, providing services, that's the fund that gets billed. So we manage that through timesheet process.
Okay.
It's almost like billable hours. If you think about how a lawyer bills, that's how we manage it.
Can I go?
Sorry.
As a point of clarification, a person who functions as a recovery coach does handle everything from housing to food security for a person who is in recovery from substance use, whether that be opioids or any other modality of addiction. So as a point of clarification, that position would be relevant. I'm very curious also to know that how much of the allocation, I know you haven't published it yet, but how much is going towards punitive measures?
Punitive measures.
I mean, as in terms of our Holyoke Police Department.
Well, right now,
Great question.
there's been no money allocated. There's been no money allocated to any activity. And if the Holyoke Police Department wanted to access these funds, they would have to apply through the grant process.
Okay. Thank you. And you did mention that the
and that goes for
responsibility went to the Justice Department before it came to your office. So that's why I'm curious.
It went to where?
You mentioned it that it was being handled by the Justice Department before.
The law.
No, it was handled by the procurement department. It had been somebody in the procurement department was getting the emails, and then somebody in the law department was getting the emails. It didn't have a home for a little while.
Okay, well, that's thank you for that, because I was a little curious about that, because as much as possible, the people that I worked with want to allocate this money for supportive measures rather than punitive ones, as much because it's really lacking.
So
I'll pass.
Any allocation of these funds will be made through, I'm going to use the word grant because that's the terminology that we use in-house, but it will be made through a grant application process. So whether that's the Holyoke Fire Department seeking funds for something they may need, the Holyoke Police Department, if the Board of Health is looking to access these funds for some purpose, any use of the funds will be made through a public allocation process where folks have to apply, be vetted, and then all of those applications go on a spreadsheet that is made publicly available. The Board of Health will then have the opportunity to review all of those applications and make its recommendations. The public will have an opportunity to review all of the applications and make their recommendations and weigh in, provide public comment. It's likely that my office will make recommendations. That has traditionally been how allocation processes are handled. Staff takes a look at it. In this case, I think it would probably be Tim and I working together to make staff recommendations. The DGR committee, the Development and Government Relations Committee of the City Council will take a look at them and make recommendations. And then the full City Council will make recommendations on how the funds should be spent. All of those recommendation levels, all of those public comments are then compiled and sent to the mayor to make the final allocations. So there is no money paid out other than we may have to start paying towards administration and sort of the planning process. So if we have to publish legal notices, that sort of thing, those expenses will come out of here. But there are no funds for use for any of the uses that are made without going through an allocation process. And that is a completely public process. If you were in town when we received our $38 million through the American Rescue Plan Act, you may recall that we had numerous public meetings, opportunities for the public to comment. We make sure that we provide language access, accessibility issues. If somebody wants it in a different format, we will provide that. We provide people the opportunity to comment in writing by snail mail, by email. If somebody's not comfortable with that, we will meet with them and transcribe their comments. We will meet with them over the telephone. We don't want to leave anybody behind. So we have lots of opportunities and methodologies that we've used pretty successfully, and we're going to apply those to this program as well.
I do have further questions, but I don't want to hog the time.
I think
you can, if you want, you can just, we can go to Earl and then you can, you can ask some more questions. That's fine. That's why we're all here. So we'll let Earl speak and then Dr. Osborne, and then you can ask another question.
And I think Debbie had her hand up too.
Oh, did she?
Definitely.
Sorry, Debbie.
So I just want to say, Alicia, I recognize the unfortunate position you're in of being the face of the whole thing. I have found myself in municipal government in that position before, and I just want to apologize like ahead of time, because it sounds very clear to me that you are doing your absolute best with what you have. So if it's okay, I just want to have a question, a story, and a question, and I will make it somewhat brief. My dog is excited. So the first question is, why is when you talk about a grant process, are we talking about an RFR process?
So we don't, yes, we are talking about an RFR process. It really is more of an RFP process because we're asking people to make proposals. So there will be an application, there will be a list of required attachments. The application will be very specific to this particular program. So an applicant is going to have to check off, what eligible category they are applying for, who are the intended beneficiaries. We ask for a cost benefit analysis. How much are they asking for? What's the use of funds? What are the proposed outcomes? All of that sort of information.
Lots of fun reading, I imagine. So the story,
I just want to say that those guidelines have not been written. So that's one of the big challenges that we have is going through all of the guidance that has been issued and writing the guidelines for the grant application itself. Because we want to make sure that we've covered all the bases, that we've enumerated the eligible uses, the eligible expenses, all of that sort of thing. And then once an entity receives a grant or is going to receive an allocation of these funds, we then execute a contract with them. Those contracts haven't even been written yet. So a lot of sort of behind the scenes work that needs to be take place to make sure this is rolled out. When we do the grant application or the RFP, it's widely disseminated. We hold training. We typically, for our programs, we hold a training session to let folks know before the grant application or before the application is released, what's going to be expected. So organizations that might be fledgling, organizations that might not have experience with funds like this, they have an opportunity to come in. We give them some training on how to complete the applications, what sort of materials they need to submit to support it, and how they can be successful.
Yeah, the standard process. Appreciate that. So I'm Earl Miller. I work at the Wildflower Alliance. We are located right at 199 High Street. We have a center. We are funded by the state. We've been funded by the district attorney. We have existed in the town for almost 20 years. We have worked with the World Health Organization, the United Nations. We see hundreds of people in the city. The only entity that has not participated in supporting us is the city of Holyoke. And I again, Alicia, I just want to say that you're the representative of the city here, but I don't think that you are responsible for the story I'll tell, which is my concern for this process is that we have a mayor who has tied nonprofits to not giving out tents to folks, to not providing some harm reduction services. And I want to tell the story of a friend of ours, a friend who came to our center, really strong young woman, had survived 38 overdoses. The last one happened at our center. And I was always really amazed that she was able to just keep getting up and going. But the thing that killed her was pneumonia, because she couldn't get a tent in this city because of the mayor's. Initially, he would not confirm it, and then he did it in the paper, which kudos. We have seen the return of stop and frisk functionally in the street. State police are stopping people routinely, just walking through neighborhoods. We're seeing folks in public housing get trespassed without any warning. My concern is that when we talk about fair and equitable, and the police are going to go through the same process, that accountability doesn't seem to have existed in this city forever. And certainly there's a lengthy history of that. And so my concern is when we talk about this as a level process, where in the history of this city would I find that? And how many, I just think it's important that we hold that this is blood money, that this is blood money. The people died. My sister died. Lots of folks that we worked with died in this city. And to hear that this money is going to go to like a housing initiative. Why did the city build a shelter? It's great that they're working with the COC, but why don't they build the shelter? Why don't they do the common sense initiatives that every other major city in Western Mass has already done? it seems like we are, and hearing the process, and again, hold nobody on this call responsible for this, it seems like we're talking about money going out in a year. And so that's going to be another winter without these things. I worry that, that while we are going to go through a process, that the same organizations that have been funded for the last 10 years will be funded again, that we will incarcerate more people. And I just feel like it's important to say that if those solutions worked, they would have worked somewhere in the last 10 years. They would have worked. If CHD, and God bless them, if CHD, BHN was going to be the miracle cure for this, they've gotten millions of dollars, they would have done it. And for us, a small nonprofit like us, what we've actually seen from the city is the police department open a community center. So when I hear this talk of collaboration, what I was actually confronted with was direct competition from the police department. And so my concern is that, you know, if we remain committed to who we are as an agency, that we would not be able to not give people resources in the middle of winter, and we would be ineligible. At least that's what is on the record. And so I say that more for the Board of Health, that like, I hope that as you're navigating this process, that you at least remain a voice for the folks who are in the streets. Like, and I just want to say again for this group that the homeless folks in Holyoke, as someone who grew up here, are not outsiders coming invading us. They are folks I grew up with, folks I've lived with my whole life, who have fallen on bad, hard times, and building luxury condos isn't going to get them out of their situation. So again, I know the folks on this call are not responsible for that, but it sure felt like it needed to be said somewhere.
We need to hear it. So thank you. We need to hear that.
My other question, so then my kind of last question is, when we talk about like working with the COC has a grant process. Is there any consideration for potentially working with Jerry McCafferty in Springfield, who has, I think, a demonstrated history of taking these sorts of funds and putting them to work, or at least putting some money into the Springfield shelter, which is certainly full of folks from Holyoke as well?
So thank you for that. I think you raised some legitimate concerns. I'm not sure off the top of my head how to respond in terms of who gets allocated, other than the mayor will have the final say. Somebody has to put pen to paper and make those final decisions. But those decisions are made after a number of systems that are built in to make those recommendations. One of the things that I do want to highlight that I see over and over and over again in this city, in funding processes, is you asked about a shelter. So we ran a $38 million COVID recovery program and had, I don't think we had, but maybe 2 requests for funding for shelter. We just did a CDBG, Community Development Block Grant round. I didn't have anybody apply for money for shelter.
I absolutely believe you're telling the truth, Alicia. I just want to say one point is during that period, the state was funding a hotel program that was substantial and easy to access. So it doesn't feel like a one-to-one.
And Alicia, I asked you at the last board meeting about all the money we have for the unhoused population in Holyoke. And you quickly, you kind of shooed me away. You gave me the quick response of how much money we had. And it was, if you could say, we actually, Tim, correct me on this, because I know you know the number. We have a great deal of money that could be used for a shelter. I work with the unhoused, and let me tell you, I personally, amongst many people, for Holyoke peeps, the wildflower, like all of the people who are here and speaking, have all begged for shelters in our city. So I really have, that was a hard statement to hear, that people haven't asked for it, because we've been fighting for a shelter in Holyoke for years.
I didn't say that people have not been asking for a shelter. I've heard you all in different settings, different agencies ask, but people have not applied for funding for a shelter. So my office runs funding opportunities. We put out requests for proposals, and we don't get proposals to operate a shelter. The only shelter that the city has funded through our office is the pop-up warming shelter at Providence Ministries.
We also, the city, I think it's probably hard because the city also publicly made a statement that we were trying to get rid of our unhoused humans. So I can't imagine that it's very comfortable for many in the community to go and reach out to those city leaders who have shunned our homeless population over and over again.
So I want to make this, I want this to be a positive experience for all of those involved.
100%.
And our role in this is really a financial management role. And so, I've been in the city a very long time. I've worked for the city in a number of capacities for a really long time. I want to try to move this forward in a way that serves the people that need it the most. And so if there is a sense in the community that we need an XYZ use or we need an XYZ service, the city needs folks who can provide those services to come forward and apply for funds. One of the challenges that we have is a lack of capacity in certain areas, in certain sectors. So for instance, I have funding available for, let's say, affordable housing development. There are very few developers, small scale developers working in the city. I can count probably on one hand who's doing small scale affordable housing development. So this is an opportunity. If there is a need for whatever service it may be, this is an opportunity for folks to come together, and maybe folks come together in a partnership. And so a bigger organization pairs with 2 or 3 smaller organizations to put forward a proposal.
And I appreciate that, Alicia, and I'm sorry the passion comes off because we've just been working so hard. And when statements like that are made, I'm just warning you, if you're gonna get a lot of passion coming back, because we've been, I don't even want to say we, the people on this meeting that came forth, because they're the true ground workers, have been doing this for years. So when false statements are made, it does kind of make us go, wait, what? Because it's a public meeting and it's offensive to those people who are doing the work to hear, and it does show, and I include myself in this privilege. I have a privilege and an ignorance to a lot of things, right? So it's our words as city leaders really can strike a nerve in people. So it's more passion, and I'm very excited that you're doing this, and I want it to be positive too, but I'm just saying we have to be careful how we use words with the people that have been doing this and doing it on their own with no funding and no help for that funding. So that's just my statement there. I appreciate that.
And Alicia, I definitely want to hear from Debbie, because nurses are awesome, and I don't know that much about that. I just want to say, and I want to take you up on your offer to be kind of positive and forward thinking about this, because I do think that's where you find yourself, right? You can't change the history of it. You can only own where we go next. Is that I hope 2 things. I hope that the community can be engaged around the development of the RFP. I hope that community members, maybe folks from Holyoke, maybe folks from here, maybe folks from all over, can be actively engaged in the RFP writing. I know it's boring work, but it actually is, the most important part, right? If you don't put it in there, it's not going to happen. And second, that the RFP kind of award process, and understanding that the mayor is the executive, that's always true in RFP processes, but that the scoring committee can be involved with people with lived experience. And I don't just mean folks who are directly impacted, but also families. And God knows we have too many of those. So I just think even in those very boring pieces, making sure that the community is actively engaged, I think would alleviate a lot of concerns. And I have no doubt that you're going to do that. Sorry, Debbie, I'm out of the way now.
So Earl, if I could, in terms of the scoring for proposals, so that's where our public comment period on proposals comes in, and folks have an opportunity to weigh in. The Board of Health will be one of the key reviewers, and so the Board of Health will do that through a public meeting, and how they want to handle that will be up to them. But I would encourage, the opportunity for public comment at that public meeting. In terms of drafting the application itself, that we tend not to have that as a public process, because there are standard questions that we're going to ask that really, in all honesty, are not up for debate. Things around eligibility and expenses and that sort of thing. They're very If you are familiar with my applications, they are very objective. They're data driven, they're eligibility driven, they are compliance driven, with some room for subjective, but they tend to be very, very objective. So I think Debbie's been waiting patiently.
That's okay. I just have a couple simple questions. I'm just absorbing all this. But my question is, how long is this grant for? I don't know if you mentioned it and I didn't catch it, but.
So we are due, I have a disbursement schedule in front of me. We are due to get disbursements through 2037. But by the time we get out to 2037, the disbursement is about $35,000 a year. So it drops off considerably over the years.
Okay. And when you mentioned there, you've got 15 inquiries.
I'm sorry. Let me correct myself. That the final disbursements, I was only looking at one column. The final disbursement by the time we get to 2038 is 91,000. So we're now at 2025. And so I'm going to average it. This is just going to be an average, but the average over the next few years is about 200,000. And I believe this document that I'm looking at is posted. I think I posted it on our website for transparency so people could see what the payments were going to be.
Okay. And then you said so far you've got 15 inquiries. How
15,
do you?
15 folks responded to the form that we had online, about 15.
And how many would you be picking from this grant or picking to, for the people to use? You're gonna pick 3, you're gonna pick 5, pick 2.
I think what we'll do is, now that we have kind of the process laid out, we're going to do the calendar. What I would do is we will reach out to the folks that filled out the form, as well as do a reach out to the community to ask folks who are interested in assisting with the assessment process and what that would entail.
Okay.
And then
some folks indicated on the form that they were only interested to be notified once the funding became available. Some folks expressed interest in working with us on doing the actual, on the ground level, person-to-person assessments.
And so Dr. Osborne, Claire, Nadia, Nicole.
Yeah, briefly, hello, Alicia. I really appreciate your leadership and filling us in on the history. I also hear that you're technically sort of the money manager, and what seems to me is we need some fresh energy from the community for organizing and maybe pushing the mayor's office. And I'm wondering about asking the city councilors to please come up with some community people that can take some leadership and push all of us in some new directions. So I thank you for your leadership. I associate myself strongly with Earl's comments and Claire's. I'm a physician. I'm retired, and so my first name is Laurie, and I'd rather be Laurie than Dr. Osborne. After 55 years of various kinds of practicing, so I'm happy to pitch in. The one comment I have is I'm well aware that we have a reasonably well-regarded State Department of Public Health. We have a number of schools of public health that are well-regarded. We have a number of communities, I think, that do pretty well with some of these things. And I'm wondering whether we should make sure we avail ourselves of the experience from there. And somebody at the state must know which communities have faced some similar problems and have some successes and not some successes. And while we're very unique, and after being in Holyoke, I view us as a incomparable, unique community, but we perhaps can learn from some other places. And I would hope we would go through that, although we certainly do need to do our own needs assessment. But look forward to being part of this, be part of this activity. Thank you.
And there are a number of resources that have been made available to the city, particularly through CARES Massachusetts, guidance on ensuring good, solid community assessment, good, solid needs assessment, potential partners. So we have been availing ourselves of those resources. and will continue to do so. I think one of the challenges for me is that I'm a regulatory person. I'm a grants manager, also happen to be a lawyer who specialized in environmental law. And so I would be the first one to say that public health, although I did get my start in the legal profession doing public health around the shellfish industry, but completely different from this sort of work. And so that's why it felt like we needed, as grants managers, to bring in the Board of Health to really address the public health piece of this. We can manage money, we can determine eligibility, we can write the reports, we could assist with the survey work and all of that. But at the end of the day, I am not a professional in this field. And so that's where I think this partnership will hopefully be successful for the city, in that we have our strong financial management side, our community assessment, our community development side with the Board of Health.
Claire? Hi,
Thank
Claire, we're
you.
coming back to you. I know you had a question earlier. And then
Yeah,
Nadia. And then Nicole.
I appreciate that. And sorry, I had to go camera off because I was moving around and I didn't want it to be too distracting. I want to just shout out to Earl for naming those the appreciation that I think we all have for the fact that you, in your specific position, it's limited, and some of these questions are going to be hardball questions from passionate people who are going to very much put you on the spot, and I want to hold that. I think my question was in regards to the feedback levels that you mentioned. Is that correct phrasing? It's like we have a public comment, and then there is a number of other.
So we have our community assessment that will be starting, where there'll be, again, and I keep saying survey work, interviews, public forums, reaching people to have conversations about what are the needs, how should this money be distributed, what's happening on the streets, what do people need, what do people need to enter recovery, for supports, what is needed out there. And then once we have that needs assessment, that then drives the allocation process on where the money is distributed. And that process also has a public comment period, a public process as part of it. So the first, you sort of think of it in bubbles. The first bubble that we're working in is figuring out what's happening in the city, taking a snapshot in time, talking to folks who are doing the work, who are on the front lines, people that are experiencing these concerns, what's happening, taking that and then molding the allocation process. And then finally, having a public process around, okay, everyone, here's who's applied for funding. What are your thoughts? How does this match up against the needs assessment? How does this match up against your own experience? What should we be funding here? So there's two opportunities for people to be involved. There are two umbrellas for people to be involved, but there will be multiple opportunities for engagement in all kinds of different formats.
I hear that, and that's wonderful. I think I'm just my question was around weight. I think because I love that we're going to have a lot of public access, and I think that like the more people who are able to engage with people on the streets, in terms of getting those comments from people with lived experience, is going to make that far more impactful. But then I'm hearing also that that the input from communities of lived experience is going to be, one of the voices, along with the Board of Health, along with, there's a laundry list of entities that we're going to have input. And I'm wondering how community members' voices will be weighted against those other, titles and department voices?
That's an interesting question. I've never encountered that in any allocation process before. I'm not sure how we would say that your voice, not Claire's voice, but that this person's voice is, or Claire's voice is greater than Nicole's voice, or vice versa, because everyone's experience is a little different. So I'm not sure that we would actually have that as a weighted opportunity. I'll have to give that some thought, to be honest with you.
Yeah. Well, I know that in
No,
my
that's-
preference, that the people who are living this experience firsthand would know best what they need for support.
Right.
And you're going to get a lot
That's
of
correct.
clinicians and people who haven't lived through it but consider themselves to be experts. And they have a very valuable voice indeed. Dude, I swear to God, you've got to get out of here. Sorry, my cats.
So, I am completely, one of the reasons that I agreed to take this project on was because it doesn't come with the parameters of the federal government that I am so used to working in. I feel like this project has more opportunities to be creative and responsive to the community than what I'm required to do by the feds. So I would make this offer to see if it makes sense to respond to your comment. And that would be, I would be willing to add in a panel of people with lived experience as reviewers of grant applications. And so that panel
Wonderful.
would have the same opportunity to review those grant applications as the Board of Health, as the City Council, as staff. I mean, I think it's a fair question, and I want to make sure that we are being responsive to the intended beneficiaries. And so if folks wanted to work with me to come up with a panel of reviewers, and we would train those reviewers on how to do it, and kind of walk them through what the expectations were and that sort of thing, I'd be willing to give it a whirl. So if you think adding in, and I look to the Board of Health, if you all think that adding in a review panel of people with lived experience makes sense,
It's
we can work-
necessary. It's necessary. I don't think it's an opinion of ours, or I don't think it's we think. I think it is absolutely necessary. It's also with the guidelines that we all, including the city, Alicia, have to follow. People with lived experience, and this may be my opinion, but I'm gonna hold on one sec. I'm gonna finish. People with lived experience have the most experience, the most knowledge of what has happened to them, what they needed when they were struggling, what they did and didn't receive. So Claire, thank you so much for being that voice. And I got your back, Claire, because they 100%, people with lived experience, those amazing, incredible humans, need to be at the forefront of this.
So I think that makes a lot of sense. We can certainly add that in.
Great.
Alicia,
And
one
as
last
a person
piece.
with lived experience, I'd be more than happy to help.
Okay, do we have your contact information?
I can certainly give it to you.
Okay, send it. Make sure that Tim has your contact information, and then we will. We can certainly do a call for. I'll think about how many. I would say probably somewhere between 5 and 7 people, because you don't want it to be too big, because then it gets unwieldy in trying to come to some decisions. But yeah, if we could identify 5 to 7 folks that might be good on the panel, that would be great.
So
And then-
I just wanted to quickly, I got to jump off, but I wanted to offer that the framework the Attorney General has includes a framework for community engagement. I might look to Communities That Care out of Washington State. It is a kind of in-depth way of engaging the community that's really thoughtful and has shown great fruit out in Washington State. So the SAMHSA one is a little bit more complicated. I think if you were like 2 or 3 years maybe, but I would just encourage you to take a look at that. And also the people who did the work are also always available for a phone call. So you can call folks and learn more if you're interested. Thank you all for such a wonderful conversation. I really, Nicole has my contact information. Wildflower would love to be involved and engaged. And Claire, it's great to see you and your cat. Hope to see you all
Earl,
soon.
thank
Oh,
you
yeah.
for coming
Great,
because
you
your
turned it-
voice
Thank
is
you,
amazing, Earl, and it's needed so much. I appreciate the heck out of what you do for our city and for coming to this meeting because you really are, you guys are the most important to come to this and speak, and I appreciate you so much.
Thank you so much.
Nadia?
Thank you. Okay. This is so exciting. I'm really excited by and energized by this conversation. I do want to point out that Greenfield, Franklin County is pretty far ahead of the game in this process. And I do think, I know that Claire, myself, Nicole, like we all have allies and friends and people who work in the field out there who have really been on the front lines, people with lived and living experience in this process. They have created some kind of committee, I believe, of people of what we're talking about, and they're compensating them as well, which I think is something that is also very important that should be taken into consideration with the creation of this, is that folks should not be doing unpaid labor, that, you know, because again, the mandate of the funds is that these folks, you know, people be centered in the conversation, because if the mayor decides to give this to the police department and it's an audit is done and it's found that the majority of people don't want this, the money can be taken away, is my understanding. So I just want to point that out. I also want to name that I've connected with some of those folks in Franklin County, and I'm hoping to have a meeting with them separately to talk about their process. I'm happy to put them in touch with you guys. I think it is really important, as Dr. Osborne said, to learn from our, you know, from our local, you know, sister and brother communities, you know, that we talk to other folks about what their process has been, because I know that the state has been very involved and is actually, from what I've heard, is looking at making Franklin County's process a model to be used statewide, because they've been so intentional and have had a process with that. The question I had really is the financial feasibility piece, and what that means in the grant process of, like, I guess I have concerns that, you know, smaller orgs, you know, even orgs that aren't even, that are doing the boots on the ground, you know, putting out harm reduction supplies, really working in that peer-to-peer space, aren't going to be taken seriously, or are not going to be, you know, held on the same kind of scope, because maybe they don't have the same financial history as like CSO or all these other honestly monopolized giant, you know, unfortunately behavioral health orgs that we have in Western Mass. So I was just curious, like what you can share about that.
I think that's a valid concern about our smaller agencies, and certainly our larger players as well. And so one of the things that we do in our office is that we do cultivate the technical skills for smaller agencies to apply for funds. We try to preemptively assist them in putting together documents, processes, procedures that they would need in order to manage the funds. And so that was what I described as sort of that technical workshop to help folks kind of get their feet underneath them. I recognize that smaller organizations do not have the advocacy teams of the larger players in the field, whether that's a housing developer, a service provider, whatever it is. Many of our service providers in the city of Holyoke are just scrambling to provide the service that they're trying to provide, whether it's food pantry, meals, whatever it is. They don't have grant writers on staff. They don't have professional advocacy teams. And so we recognize that. And so through kind of the preemptive technical training that we're hoping to get folks to take advantage of, as well as a grant application that is as objective as we can make it, and geared towards the non-professional grant writer. So there are minimum standards that the agencies will have to have, but I deliberately designed the processes so that we're not closing the door to very small scale operations.
Okay, awesome. Thank you.
And there's certain, there's certain criteria that everyone will have to take, that everyone will be subject to. So things like, conflict of interest and that kind of thing. Like there are things that we just can't waive.
Yeah.
We really do try to cultivate our smaller agencies because sometimes they're doing the best work, to be honest with you. They don't have all that overhead. All they want to do is just provide their service, and we work with them. And then to take that a step further, we typically operate our funding cycles. Sometimes are reimbursable. Sometimes we do direct payment. I like to stay away from direct payment because it's harder to chase. So we recognize that agencies may not have the ability to do activities on a reimbursable basis where they put the money out and then come back to me and request payment. And so we come up with some creative workarounds for that. So for instance, if an agency wants to purchase harm reduction supplies and they don't have the cash in hand to actually purchase them and wait for reimbursement, we may be able to work with them if they received an allocation where we pay the distributor directly.
Okay. Yep.
So we try to be creative. We try to be mindful because really in order to serve the city, we need everyone at the table, whether it's a two-person agency providing lunches, whether it's the bigger players because they do have a role. But we're going to work to try to cultivate that.
Awesome. Thank you. Just a quick follow-up. I think speaking, to what Earl mentioned and just like, the police department and so forth. Oh gosh, I just lost my train of thought. Yeah. Oh, here it is. For agencies like CHD that have been like, you can't give out tents anymore, and these encampment sweeps, and the direction that things seem to be going in, which is very much not a harm reduction approach, which is a punitive approach, which is a carceral, honestly creating more deaths, to Earl's point about that poor woman who died of pneumonia, like completely preventable death. What will be done if those organizations apply for these funds and want to do work that like Josh doesn't approve of, or that, you know what I mean? And then not only do those folks not get the funding, but then they're targeted for the work that they do continue to do in the community, doing life-saving work. Like, how do we protect these entities that are actually saving our people? Like, I worry that there has been such a public display of stigma, of disgust, of dehumanization, of NIMBYism, of that's not our problem, even from more folks that I would think would be more open-minded. And I hear this, we have too many nonprofits. If we had enough services, if the city was working, if things were working well, we wouldn't have this problem. Do you know what I mean? And it's like, this is only creating more problems. Like I'm appalled and embarrassed and ashamed that people can even, you're going to go through Kmart, behind Kmart, and take people's tents away. What are they doing? They're not harming anyone. It's not illegal. And I'm sorry, I'm just like getting really upset about this, but I just feel like, where is the accountability? Where do we ensure that the people who need to be centered in this conversation are centered, and that the folks who are doing this work currently are not targeted, are not discriminated against because somebody doesn't have a moral agreement with the way that they're doing this work, or however he justifies his view and his choices to enact public safety.
As the old guy here, I feel it's important for an apology that my generation, especially my generation of physicians, is not leaving the world, the planet, or the medical profession better off than we found it. And I'm sorry about that. As physicians, we have made billions of dollars, especially increasingly from treating preventable disease. And public health and mental health have been discriminated against, and that was my perception back in medical school in the 60s, and it's only gotten worse. And So I dedicated my career to public health and mental health, and have been relatively a relative failure because we haven't made much headway. Anyway, you guys are right on, and my beginnings were in community mental health, which was a wonderful public health based model of mental health with prevention built in and substance abuse built in, and the Fed stupidly bailed out of it in 1980. Stupidly bailed out of it for a fee-for-service model. And the marketplace is not competent to regulate health or public health, and so the for-profit private insurance industry is doomed. It's going to come unraveled, and maybe sooner rather than later. Anyway, sorry, it's a negative, but this effort is very important, and the energy that comes from this group of people in the community, it's reborn, and I'm delighted to be part of it.
So Nadia, I heard everything that you said about your concerns. I don't have a response other than Tim and I and our teams are committed to making this as open and a transparent process. And I know the mayor he wants the best for the city. He wants the best for every single individual in the city. And that's what we're going to work towards. I would ask that you have a little, I know what has been said. I know the conversations. I'm not in the dark about what has transpired. But I'm hopeful for this process, and I do have faith that we can pull off a really good process that has good results in the end.
Thank you, Alicia.
I guess I'm asking you to sort of trust the process. I know that's so classic bureaucrat, and I'm here from the government. I'm here to help, which clearly these days is not feeling very good. I can only give you my word that the team that's going to work on this internally is going to give it our all and try to do it as transparently and as open-minded as possible, and to hope that we have as many people at the table, because I also think that will drive the outcomes.
Awesome. Thank you so much. And I know that was a big question that I asked, and I know it's not on you. And we want, we really appreciate your commitment to this, and like however we can support y'all in this process. Like, I know everyone at this, like, we're here to help. So whatever we can do to be part of this and to support you in ensuring that transparency, we want to help. So
I will come again and again. I'm not afraid of tough questions. I'm not afraid of being on the hot seat. I will speak to you honestly about where we're at and the challenges that we have and the positive things that we have. Like I said, I have a long history in government and all kinds of projects. This one to me, I feel like I'm taking on quite a challenge, but I also feel like that our teams that are working on it are equipped to make this happen.
You're not alone.
Right. And I appreciate that.
And
but
I believe too, Alicia,
I will show up and answer the tough questions.
I do believe Alicia was the one who put the Board of Health as a recommendation as well, so that we could review the applications as well. Right. So that, we gotta definitely give some credit there, because then we have a say in that. So in anything, she drives these processes often. So anything she needs from me, I will accommodate her to get things done as quick as possible.
I appreciate that. I appreciate that, Tim.
I'm not here tonight to say this is going to be speedy. It's going to be it's going to be kind of a slow slog through it. We're wrapping up a $37 million project that funded over 80 activities that we're currently operating with a team of 3. Up until last Thursday, I wasn't even sure I was going to be employed on July 1st because of such severe federal budget cuts. So Now
I
we've,
hear you. I'm glad you're still here, Alicia.
Yes.
We need you. And I'm still gonna be the thorn in your side because I have that responsibility to my peeps that are suffering right now, that I care for. And that's why Tim will tell you, I'll email him every day when I see people struggling, when I see they're not getting their meds, when I see amazing organizations not getting our support. I know you're here for us. And just get ready for my emails because as it's been, like I said, 3 years and over 80 people have died, and I just can't sit quiet and wait for anything less than let's hit the ground and get running attitude.
and
And
Nicole,
I'm
we see it-
here to help you with that. I'm 100% here to help you with that as well.
and we see it every day as well. I mean, it's not, we don't go to work. Tim and I don't go to work with blinders on. We see it. I mean, I see it with my own eyes walking back and forth, being downtown. I see it in the data, in the point in time count.
They're on city hall property, you know, like the opioids. So I mean, this is how bad this problem is, that we go out, you know, just into the courtyard and we see needles and everything. So if it's that bad around city hall, you can imagine where, you know, we definitely need to start mobilizing and getting these resources out because yeah, we definitely have we have a
And
significant.
the humans involved aren't just, what we see when we say needles, and they're not just, the
No, but
people that we
yeah.
see downtown. This is something that affects every single one of us, every family, every neighborhood, every community member. So we have to, that's why these guys here are so important to remind us that it's not just what, and I always, like I said, I include myself, not just those of us that are privileged that think we see it, right?
Every
It's
family, every family.
those people living it. Those are
Yeah,
that's
what
what
I
the
just
opioid epidemic
what
is.
I
But
what I meant though is just it being so close to
no, I
City
hear you.
Hall, you know, it's
Yeah.
throughout the city even worse,
Mhm.
you know.
Yeah.
Um,
And
so
Tim,
and
you've
then
been awesome with it. Tim
um,
is like I have to give Tim credit because Tim and Debbie are like lone rangers over there with their team fighting this epidemic. And
well,
Tim takes such good Tim's direction with all my crazy emails is awesome. And I appreciate you because I came to Tim and asked Alicia to be here for this reason. And he jumped right on it because us with the Board of Health, just to clarify, we're not part of this as of 2 weeks ago. So I'm so pumped that we are and that we can help get this rocking and rolling.
and then so Claire, you had a question?
Oh, I just want to be sure I know how to get my contact information to you.
Oh, yeah, I was trying to figure that out this whole time because I don't have a chat button, but do you have a pen and paper? I'll just give you my email right now.
Hang on a second.
If you go grab it, I'll give it to you. 'Cause I can't find it for some reason. Most of my Zooms have.
I'm here because I ran into Nadia at a rally.
Oh, really?
So
Great. Then. There are a
she
lot of
knows
great.
me
glad it
through,
worked now.
yeah. All right, I got it.
Okay, it's RIVERST @holyoke.org. And that's Rivers T, like a body of water.
I got it. Rivers T,
Okay.
as in your name, Timothy Rivers at
I
Holyoke.
just wanted to make sure, and I'll give you our
.org.
office phone number too, in case you had any issues. It's 413-322-5595.
Great. Okay, I'll shoot you an email just to say hi after this so that we can make a connection.
Excellent. Okay, so does anybody have any questions for Alicia?
I guess I just want to know what's next.
So what's next? So let me give you sort of my 2-week goal. I want to have the final calendar out, sort of my work list for the next couple of weeks. I want to finalize the calendar so folks know what our target dates are for what. I want to, I have a team member that's currently working on the allocation application and the guidelines. so that we will be ready to roll that out. That same team member is also doing a mini application for agencies to apply for funding if they need some funding to assist us with the assessment process. So Ashley is working on that. We expect that to roll out pretty quickly. And so within 2 weeks, you can expect to see the calendar posted on our website, the management plan posted on our website, and then we will continue to build out how we're going to do the community assessment.
We did decide too that we would, I have it formatted. I'm going to start writing some questions tomorrow that we said between 5 of us will take the categories of the funding and then develop 5 questions each and then run that by providers. That was something we had discussed on Tuesday.
Jim is working on the actual survey for the community. So, but we know that the community assessment process is going to be more than a survey. So that's the other piece that we're building out.
Great, thank you.
I think one of the challenges that we have is certainly there's always a capacity concern, obviously, but we're also headed into the summer months. And so I find that like community forums and that kind of thing during the summer aren't as successful because people are away. So we want to try to figure out how to manage that. So I think part of that will be making sure that we have lots of different kinds of opportunities for people to weigh in. We have a lot of groundwork to do. We have a lot of ground to cover. We need to talk to providers and folks with lived experience and family. We just have a lot of ground to cover to build out that needs assessment. I should also mention that we're going to do this at this point in 3-year increments. So hopefully we'll have a community assessment done every 3 years. So we're going to do it now. We're going to get some money on the streets. Those will probably be 3-year allocations, and then it will be revisited in 3 years because the capacity to do this every single year is just, it's a lot. So we figured if we did it every 3 years, take a snapshot in time now, give out some money on the streets, see how projects go, where are we at in 3 years? So that seemed to make a lot of sense.
Okay, great. Thank you. Yeah, I know I have at least 4 other colleagues and friends who live in Holyoke, but don't necessarily work in Holyoke, but are in like social work, harm reduction, so forth. And I know they really wanted to be here tonight, but they couldn't be. So should I direct them to the website to fill out the form?
Yep,
Okay.
I would direct them to the website, and as we have stuff to roll out, we're going to put it there. So I would keep sharing it, and we'll keep updating it.
Okay, cool. And you want them, even if they're not working in Holyoke, they should still put like an agency or organization they're affiliated with. Is that right? Okay.
Yeah,
got it.
we had some. I think some of the folks that replied were from outside the city.
Yeah.
So
Okay.
that's fine. Absolutely.
Great. Thank you.
So, and just in terms of capacity, the webmaster for that website is me. We don't even have an IT. We don't have an IT department. So anything you see on a city's website is because the department heads are putting it up there. So yeah. So, but please direct folks there.
Okay. Thank you.
Okay, anybody have any more questions for Alicia?
One
Okay,
more quick one.
Alicia.
I got someone's just messaged me. I love this because some people couldn't be here, but for the RFPs, and forgive me because the financial side is not my thing. I'm on the health side of things. Will municipalities such as like fire department, Board of Health, specifically the police department, will they have to apply for all of that as well, even though they're a city entity?
Yes.
Perfect.
Yes. I hope I made
Awesome.
that very clear at the beginning of the evening. Yes. So that's
Okay.
the way we operate is if a municipal department wants to apply for the funds, whether it's these funds or COVID recovery funds, they apply through the process.
All right. I really, that transparency is so important to us with the, with police being involved.
There are no side deals with any of this funding.
Awesome.
Good.
at least that I'm going to sign. Now, but no, a municipal department that would want to access the funds has to apply. And part of that is a financial management, because we can't have $100,000 grant going out over here and thinking that, so it all flows through an allocation process. And what we can do is I'll put up a sample allocation process on the website so folks can get an idea of what it looks like. Because we group the applications, and we'll probably do the same thing here. We group the applications by category. So for instance, if there's housing providers that are applying, all the housing providers get grouped together, and then all of the harm reduction folks get grouped together, so that people are comparing apples to apples.
Just a question. Could you, Alicia, because it's been really helpful to me, that put up and it might already be, I haven't looked at it, your site yet, put the Attorney General's site on there, because it's so helpful with all of the guidelines and all the information. It's kind of done for us.
I think we linked it, but I'll double check.
Okay, awesome. Thank you.
We had pulled out some resources. I think I have CARES on there, the Care Massachusetts, but I can add it. We actually have an agreement. We have an executed agreement with the Attorney General's, and that's our base document.
I know. Yeah, no, I know. That's why I was making sure it's on there. They're incredible. They're very helpful. They've helped out other cities. They're here. They're excited. We have a great Attorney General to help us through this too.
So we've met with them. The mayor and I have met with them.
Yeah, Tim and I did too. So that's great. That's why I wanted to make sure it was on there. They're awesome holding us accountable.
Erica, right?
Yeah, Erica Hensel is our contact, is the city's contact person. She's another incredible human.
I'm just going to go over and look, because I think, let me just see if I can find it real quick.
I'm a research nerd. I like to look up all those facts and have it.
So we have links to Care Massachusetts. We have the agreement on there. We have the March 2025 accounting of settlement funds. We have some quick facts, and then we have the talking points for municipalities. So we've already got several resources up there.
Okay, I can share it on the Board of Health website too. I just think it's really important, seeing as that's
What
where
we can
our
do
funding
is
is coming from.
I can ask the person that assists us with the website. There's a way that we can do a link from the Board of Health. So the Board of Health can have a tab that says opioid response, and then it will take you over to this page.
Perfect. Yeah. I sent it, and Dr. Osborne, I sent it to you and Letitia too, just because it's really cool to look at. It's literally what they're guiding our city on, and everything. It goes off of what the Attorney General.
Yeah, it looked very detailed and looked very sort of
So Tim,
cool.
we can ask Jeffrey Burgos Anderson. We can ask him to help us create that link from you.
Yeah.
So that way people don't have to go hunting for it as much.
Yeah, I would say that's the most important for this.
I acknowledge that I think we're one of the few communities where the funding isn't entirely in the Board of Health.
Yeah,
I remember you saying something like that.
Yeah, so we'll make sure that it's linked there.
Yeah, it is, because that's what, at the last meeting I was at with colleagues, they were shocked that Holyoke hadn't done anything yet, and then they're like, "Wait, what do you mean you're a commissioner and the Board of Health's not involved in this?" And that's when I reached out, because I was like, "Yeah, we're the only one that's not."
Tim, you want it? You can have it.
Yeah, right. I know. Like I said,
we definitely want passionate people who want it involved, people who want to save lives.
I'll figure out, whatever I need to do, I'll do to get things done. So if whatever you need help with, I know the mayor did assign it to you, but whatever you need help, I'll drop everything just to get the ball rolling with this. So I'll figure it out. So like I said, anything you need, You know, I might need some guidance on some of the financial or the community needs. I've never done one of those before, but anything that I can do to help and just with a little guidance, I'll be happy to do.
Absolutely.
We get some students in to help from UMass, School of Public Health, somebody like a PhD thesis and come and help work for you. Things like that.
Not a bad idea. We've had interns, but with Debbie, more so.
Good
I believe
idea.
that is a good idea. Okay, so if we don't have any more questions, I see your cat there, ready for mom to go. Anyways, I just want to thank you so much for being able to brief everybody on this information. Thank you for coming. And we'll keep working together to get this done, and I'll be informing the board, whatever steps we're on. So thank you, Alicia.
Thank you to our community members too, you guys. We want more involvement in our meetings, so please come to more because we
Yes,
need you
Claire.
guys here.
Thank you, Claire.
Yes, Claire, Nadia, and Earl, you guys are, and Bridget was on. You guys are, thank you
Yeah,
for
you
coming.
guys
'Cause we don't get the community involvement that we need. You guys
You
are
know what, and
important.
Nadia, you kind of said stuff like with the tents and everything, and we're on the other end where we're the Board of Health, where we do enforcement on, if somebody thinks something's trash and litter and this and that, where people call us. Like Alicia gets more of the community, like I don't know where to go, where we get the complaints about the community. And I remember reaching out to Nicole when I first started, because I was like, I'm supposed to deal with people. Like, I'm like, where are they going to go? If we're taking away encampments, where do the people go? And I they tried to speak to me like, oh, they have somewhere to go. They just don't want to. And then when I started digging a little more, and then I reached out to Nicole, I was like, oh, there is nowhere to go. You just want me to believe that. So it became, kind of a roller coaster of learning, the different things about the unhoused community. And I'm so thankful I didn't just do what I was being kind of prompted to do. And I reached out to my board, and that's the point of a board, really, is to make better decisions. Because ethically, Board of Health, you can't take shelter away and give somebody worse health, worse conditions. You have to, look at who's the most vulnerable in a situation in public health. And I can't thank you guys enough, because I've been educated by the community, in the different situations. And Nicole, kind of led me into that. I connected with a lot of different community
I
members.
forced him. He's
Well,
awesome. Tim's
she-
great. Tim is so
she
awesome.
did-
He
she-
deals with a
she-
lot with me.
Hey. I think the last text was, don't be mean to me. So anyways, I want to thank you guys, and I just continue to educate people like me and the rest of the public. And Holyoke is tough because we have a severe problem with opioids, but we have two sides of the city that don't always agree with what the best approach is. And that becomes an area where we're going to have our hands full, I believe. So the more community members that can be involved and educate the public is needed, because if you're one or two city employees against, a barrage of, a certain attitude towards people, then it can be difficult to, defend. You're kind of standing on your own if you don't have the
Right.
support community, so, and I'm sure you know that on your end as well. So you have our support and we need yours.
Absolutely. We're happy to help organize, it definitely takes a team, and I'm glad you reached out to the board. And, people are just people, and I think there's a lot of perceived threats that are in the wrong place. And I think the more that I hope that we can have some real community dialogue. Like I would love to see that. I didn't say this to Alicia, but maybe in that needs assessment process, I don't know if it's city council meeting, but I think it would be really important to just get a better landscape of like people's perceptions, you know? I mean, obviously that's the needs assessment, but you know, if there is a community forum, if you guys think that's helpful, I know we could get the people in the room and or our, you know, we could get people in the room. So definitely down to do that. And I will, in the meantime, direct people to the website, as Alicia said.
Yes, that's great.
Yeah, and thank you guys so much. Like this has been such a great experience. I really appreciate all of you so much, this entire board, and so stoked that we've all been able to be part of this conversation.
Thank you. And Claire, thank you also for coming and sharing your experience.
Yes, thank you, Claire.
Thank you. I just ran into Nadia on May Day.
Yes, it was kismet. I knew it. It was kismet.
Yes.
Very kismet.
So,
So Tim, I'm writing you an email right now.
sorry, you're what?
I'm writing an
Oh,
email.
Claire. Okay, yeah, and I'll also share Alicia's email with you as well. And you
Fabulous.
know, you can reach out if you ever want to reach out to me alone or both of us. You know, that's good as well. You know, that's part of the process. So it can be her as well. And you know, any ideas you have or anything, you know.
Mhm.
And I think it would be a good idea too, if like, one of the things I was thinking where Alicia said she would come, you know, anytime and she's not opposed to difficult conversations, is maybe reviewing her calendar on what she feels are good timings. And then maybe reconvening in 2 months and make sure we're on track, holding the city employees accountable for what they say they're gonna do.
Yep.
And if we're a little behind is one thing, but months right now, if you look at the calendar, well, I sent you guys the draft, we're 5 months behind, you know, and then, you know, one of the things is when I was going over things with, you know, her assistant, we thought like, I think she was thinking like May 2026. And her, at least, I remember I was saying to you, Nicole, her assistant and I were looking at like what we needed to do. And we're like, if we rush, maybe we could even get it for February of 2026. And then honestly, reviewing it opposed to like what other people are thinking, or once she goes through the calendar, maybe we can get more of the ball rolling. I'm just trying to go with what that calendar says. And you got the 30 days of public comment period, which takes 2 months out of the equation on what you need to do as well. But like I said, I'll rush anything I need to get, not rush to make bad decisions, but rush to get things moving where we can start reviewing applications. You know, we know on our end what we see in the city, but once you get those different perspectives, you'll see like, what does the city want? What do the people that have lived experience really need? You know, so yeah, I think it will be good to try to get this ball rolling as soon as possible. So